Welcome to another episode of Med Madness, where we dive deep into complex medical topics and break them down into clear, understandable concepts. Today, we're focusing on a critical and often overlooked cause of anxiety, anxiety due to another medical condition. Specifically, we'll explore how certain medical disorders like pheochromocytoma and hyperthyroidism can manifest with anxiety-like symptoms. Misdiagnosis can lead to ineffective treatment, so understanding these conditions is crucial. Let's start by discussing anxiety as a common symptom that can arise from various causes. While it's often linked to primary psychiatric disorders, there are cases where anxiety is driven by an underlying medical condition. Two such conditions that frequently present with anxiety symptoms are pheochromocytoma and hyperthyroidism. Next, let's discuss pheochromocytoma. Pheochromocytoma is a rare but serious adrenal gland tumor that secretes excess catecholamines such as epinephrine and norepinephrine. These hormones are responsible for the classic fight-or-flight response, and when produced in excess, they can cause significant physical and psychological symptoms. Patients with pheochromocytoma typically experience episodic headaches, palpitations, sweating, severe drug-resistant hypertension, and hypoglycemia. These episodes can be accompanied by intense anxiety or panic attacks. The intermittent nature of these symptoms often leads to a delayed or missed diagnosis, as the anxiety and other symptoms may be mistaken for a primary psychiatric disorder. However, the key differentiating factors include the presence of severe hypertension, hypoglycemia, and the characteristic episodic nature of symptoms. The diagnosis is confirmed by measuring urinary and plasma levels of fractionated metanephrines and catecholamines. Next, let's discuss hyperthyroidism. Hyperthyroidism occurs when the thyroid gland produces too much thyroid hormone, leading to an acceleration of the body's metabolism. This can cause symptoms such as palpitations, sweating, tremors, and anxiety, which are easily confused with primary anxiety disorders. However, hyperthyroidism may also present with symptoms not typically seen in psychiatric conditions such as unintentional weight loss, new-onset atrial fibrillation, and menstrual irregularities. The first step in evaluating a patient with these symptoms is to measure serum TSH levels, which are typically low in hyperthyroidism. Proper diagnosis is essential for guiding treatment and preventing mismanagement. Now let's consider a real-life case study. Consider the case of a 45-year-old woman who presents with episodes of severe headache, palpitations, sweating, and intense anxiety. She has been treated unsuccessfully for anxiety with multiple medications over the past year. Her physical examination reveals elevated blood pressure and a normal body mass index. Further evaluation shows elevated plasma metanephrines, leading to a diagnosis of pheochromocytoma. After appropriate treatment, her anxiety and other symptoms resolve. This case highlights the importance of considering underlying medical conditions when evaluating patients with anxiety symptoms, particularly when standard treatments fail. To wrap up, it's crucial to remember that anxiety can sometimes be a manifestation of an underlying medical condition such as pheochromocytoma or hyperthyroidism. Misdiagnosis can lead to ineffective treatment, so maintaining a high index of suspicion is key. By understanding the distinguishing features of these conditions, healthcare providers can ensure accurate diagnosis and effective management. Before you go, don't forget to check out the pre- and post-podcast quizzes to test your understanding of today's topic. We've also created Anki flashcards to help you solidify your knowledge. Engage with these tools for a more effective study session. Thank you for tuning in to Med Madness. Until next time, keep learning and stay curious.